Okay, so we're actually trying to look at the menstrual cycle as related to pelvic inflammatory disease. Okay, so trying to link these two concepts is you're actually trying to say if menstrual cycle actually has a role to play in pelvic inflammatory disease. You understand? So looking at this, okay, this is a menstrual cycle which have to do with all of that process that leads to release of an egg and shedding of the endometrium if there is no implantation. So it can significantly just so you know that the pelvic inflammatory disease, which is inflammation of the uterus, okay, the fallopian tubes and the ovaries, it can actually disrupt somebody that has pelvic inflammatory disease. There will be some issues that the person will have during menstruation. Do you understand? So it can actually lead towards irregular periods. So your period is not the regular 28-day period that we know again. Okay, the person is now having heavier bleedings, okay, when they are menstruating, and of course the menstrual pain is actually more. All right, so pelvic inflammatory disease is just an infection of the female genital tract, where there's now inflammation of the uterus, inflammation of the fallopian tubes, inflammation of the ovaries. Okay, so it typically results from infections from some microorganisms like the chlamydia trachomatis, the Neisseria gonorrhea. Okay, so it now usually spread from the vagina. So it spread from the vagina down here up. Okay, it's an ascending infection. Okay, usually probably maybe sexually transmitted, or sometimes the normal bacteria that grow in the vagina can now be growing too much and cause these issues. So what's the impact of pelvic inflammatory disease on the menstrual cycle? You're having irregular periods. You can miss your periods, right? Then the bleeding you usually have in your periods, you notice that is actually more. Okay, then of course the pain will be more. Okay, so other issues you have is things like lower abdominal pains, pain when you try to have sex, okay, unusual vaginal discharge, fever and chills. That's probably when the infection is kind of like going into the bloodstream and all of that. Then if you try to urinate, there's a whole lot of pain. So